Welcome to my channel only ankylosing spondylitis. Today we discuss about Crp C-reactive protein in ankylosing spondylitis disease. So what is Crp? C-reactive protein is a substance that is produced in the liver and the level of which indicates presence of inflammation anywhere in body. The level of Crp is measured by blood tests. The higher the levels of Crp, the greater is the inflammation. Thus, Crp is described as acute phase reactant. Some other substances produced in the body that acts as acute phase reactant to ESR and platelets. Normal range of C-reactive protein. High C-reactive protein levels indicate inflammation, and thus it will only be detected on blood tests if there is some sort of inflammation or infection present in the body. C-reactive protein or Crp is measured as the amount of Crp in milligrams for every liter of blood or milligram per liter. Normal range of C-reactive protein is less than or equal to 3.0 milligrams per liter. A standard Crp test cannot often detect normal levels of the Crp as they are so low. A high-sensitivity Crp or C-reactive protein test can detect levels below 10.0 milligrams per liter. Such kinds of tests are performed for determining the risk for cardiovascular disease. Treatments for elevated C-reactive protein or Crp. The treatments for elevated C-reactive protein or Crp and the prevention, both are based upon the underlying conditions. Following proper diet, regular exercise and reducing smoking along with cholesterol-lowering medications, one may reduce the cholesterol levels and also the elevated C-reactive protein levels. A decrease in Crp levels is observed with use of statins, even though there may not be significant improvement in the lipid profile. Apart from this, treatments for elevated Crp is also done in people with a history of cardiovascular disease and are on aspirin. However, aspirin use is generally not advised in people without any history of cardiovascular disease and are not even at risk of having it. Certain diabetic drugs such as thioglidinediones also decrease the levels of elevated Crp in people with or without diabetes. Anti-inflammatory diet and herbs as the treatments for elevated Crp. It is recommended that an anti-inflammatory diet that include 2 to 3 servings of salmon or sardine fish per week, or fish oil supplements can be helpful in reducing the levels of C-reactive protein. Apart from the anti-inflammatory diet, anti-inflammatory herbs such as turmeric and ginger are also known to be beneficial in treating elevated Crp levels. It is also essential to quit smoking, take balanced diet and go for regular exercise can be very much beneficial in reducing the levels of Crp. Research indicates that as the fitness levels decline, the C-reactive protein level increases. Now mainstream for control C-reactive protein naturally. For ankylosing spondylitis patients, here are some tips and tricks for Crp control for ankylosing spondylitis. Choose brightly colored fruits and vegetables. Some tips. Fruits and vegetables. Tomatoes, strawberries, blueberries, spinach, carrots, oranges, olives, avocado, kale. Protein sources. Anti-inflammatory protein sources include most fish and seafood, and some plant-based sources. Some examples: salmon, tuna, sardines, trout, non-fat yogurt, soy foods, dry beans, walnuts, almonds, pecans, Brazil nuts, fats and oils. Omega-3 fatty acids and monounsaturated fatty acids are an important part of an anti-inflammatory diet. Many of the protein sources also contain beneficial fats, including fish, seafood, soy, avocados, olives and all those nuts. In addition, choose these: olive oil, canola oil, rice bran oil, grapeseed oil, walnut oil. Beverages. Drink tap, sparkling or bottled water, 100% juices, herbal tea, low-sodium vegetable juice, and low or non-fat milk. So we can control and manage our Crp through this natural way. Thanks for watching my video. Please watch and share. Only Ankylosing Spondylitis channel.